first wave of early 1918. The pandemic is conventionally marked as having begun on 4 March 1918, with the recording of the case of Albert Gitchell, an Army cook at Camp Funston in Kansas, United States. Despite there having been cases before him. 27 The disease had already been observed in Haskell County as early as January 1918, prompting local Dr. Loring Minor to warn the editors of the U.S. Public Health Service's academic journal, Public Health Reports. 8 Within days of the March 4 first case at Camp Funston, 522 men at the camp had reported sick. 28 By 11 March 1918, the virus had reached Queens, New York. 29 Failure to take preventive measures in March-April was later criticized. 30 As the U.S. had entered World War I, the disease quickly spread from Camp Funston, a major training ground for troops of the American Expeditionary Forces, to other U.S. Army camps in Europe, becoming an epidemic in the Midwest, East Coast, and French ports by April 1918, and reaching the Western Front by the middle of the month. 27 It then quickly spread to the rest of France, Great Britain, Italy, and Spain, and in May reached Breslau and Odessa. 27 After the signing of the Treaty of Brest-Litovsk, March 1918, Germany started releasing Russian prisoners of war, who then brought the disease to their country. 31 It reached North Africa, India, and Japan in May, and soon after had likely gone around the world, as there had been recorded cases in Southeast Asia in April. 32 In June, an outbreak was reported in China. 33 After reaching Australia in July, the wave started to recede. 32 The first wave of the flu lasted from the first quarter of 1918 and was relatively mild. 34 Mortality rates were not appreciably above normal. 2 In the United States, 75,000 flu-related deaths were reported in the first 6 months of 1918, compared to 63,000 deaths during the same time period in 1915. 35 In Madrid, Spain, fewer than 1,000 people died from influenza between May and June 1918. 36 There were no reported quarantines during the first quarter of 1918. However, the first wave caused a significant disruption in the military operations of World War I, with 3/4 of French troops, half the British forces, and over 900,000 German soldiers sick. Deadly second wave of late 1918. The second wave began in the second half of August 1918, probably spreading to Boston and Freetown, Sierra Leone, by ships from Brest, where it had likely arrived with American troops or French recruits for naval training. 37 From the Boston Navy Yard and Camp Devens, later renamed Fort Devens, about 30 miles west of Boston, other U.S. military sites were soon afflicted, as were troops being transported to Europe. 38 Helped by troop movements, it spread over the next 2 months to all of North America, and then to Central and South America, also reaching Brazil and the Caribbean on ships. 39 In July 1918, the Ottoman Empire saw its first cases in some soldiers. 40 From Freetown, the pandemic continued to spread through West Africa along the coast, rivers, and the colonial railways, and from railheads to more remote communities, while South Africa received it in September on ships bringing back members of the South African Native Labour Corps, returning from France. 39 From there it spread around southern Africa and beyond the Zambezi, reaching Ethiopia in November. 41 On September 15, New York City saw its first fatality from influenza. 42 The Philadelphia Liberty Loans Parade, held in Philadelphia, Pennsylvania, on 28 September 1918, to promote government bonds for World War I, resulted in 12,000 deaths, after a major outbreak of the illness spread among people who had attended the parade. 43 From Europe, the second wave swept through Russia in a southwest-northeast diagonal front, as well as being brought to Arkhangelsk by the North Russia intervention, and then spread throughout Asia, following the Russian Civil War and the Trans-Siberian Railway, reaching Iran, where it spread through the holy city of Mashhad, and then later India in September, as well as China and Japan in October. 44. The celebrations of the armistice of 11 November 1918 also caused outbreaks in Lima and Nairobi, but by December the wave was mostly over. 45. American Expeditionary Force victims of the Spanish flu at U.S. Army Camp Hospital, number 45 in Aix-les-Bains, France. In 1918, the second wave of the 1918 pandemic was much more deadly than the first. The first wave resembled typical flu epidemics. Those most at risk were the sick and elderly, while younger, healthier people recovered easily. October 1918 was the month with the highest fatality rate of the whole pandemic. 46. In the United States, 292,000 deaths were reported between September-December 1918, compared to 26,000 during the same time period in 1915. 35. The Netherlands reported 40,000 plus deaths from influenza and acute respiratory disease. Bombay reported 15,000 deaths in a population of 1.1 million. 47. The 1918 flu pandemic in India was especially deadly, with an estimated 20 million deaths in the last quarter of 1918 alone. Third wave of 1919. In January 1919, a third wave of the Spanish flu hit Australia, where it killed around 12,000 people following the lifting of a maritime quarantine, and then spread quickly through Europe and the United States, where it lingered through the spring, and until June 1919. 48, 49, 50, 45. It primarily affected Spain, Serbia, Mexico and Great Britain, resulting in hundreds of thousands of deaths. 51. It was less severe than the second wave, but still much more deadly than the initial first wave. In the United States, isolated outbreaks occurred in some cities including Los Angeles 52, New York City 1, Memphis, Nashville, San Francisco and St. Louis. 53. Overall American mortality rates were in the tens of thousands during the first 6 months of 1919. Fourth wave of 1920. In spring 1920, a fourth wave occurred in isolated areas including New York City 1, Switzerland, Scandinavia 55 and some South American islands. 56. New York City alone reported 6,374 deaths between December 1919 and April 1920, almost twice the number of the first wave in spring 1918. 1 Other U.S. cities including Detroit, Milwaukee, Kansas City, Minneapolis, and St. Louis were hit particularly hard, with death rates higher than all of 1918. 57. Peru experienced a late wave in early 1920, and Japan had one from late 1919 to 1920, with the last cases in March. 58. In Europe, 5 countries, Spain, Denmark, Finland, Germany, and Switzerland, recorded a late peak between January-April 1920. Signs and symptoms. As Army symptomology of the flu, majority of the infected experienced only the typical flu symptoms of sore throat, headache, and fever, especially during the first wave. 87. However, during the second wave, the disease was much more serious, often complicated by bacterial pneumonia, which was often the cause of death. 87. This more serious type would cause heliotrope cyanosis to develop, whereby the skin would first develop 2 mahogany spots over the cheekbones, which would then over a few hours spread to color the entire face blue, followed by black coloration first in the extremities, and then further spreading to the limbs and the torso. 87. After this, death would follow within hours or days due to the lungs being filled with fluids. 87. Other signs and symptoms reported included spontaneous variants of SARS-CoV-2. Several variants of SARS-CoV-2 have emerged that are spreading globally. The most currently prevalent, all of which share the more infectious D614 gene mutation, are 181, 182B1.1.7, also known as the Alpha variant, first detected in the UK, which has spread to over 120 countries. 1, also known as the Gamma variant, first detected in Brazil, which has spread to more than 50 countries. 1.351, also known as the Beta variant, first detected in South Africa, which has spread to over 80 countries. 1.617.2, also known as the Delta variant, first detected in India, which has spread to over 70 countries.